A couple of stories, they tend to honestly follow a similar pattern with each other because you tend to have this similar type of patient looking for a similar type of result, i.e., the increased aesthetics of it all. But the fun part is the variation and the reasons, I guess, why. Some patients will come in because they have children that are getting married, or they have an important graduation, or even like a vow renewal of their own marriage, and wanting, valuing that upcoming event so highly to have that be the motivating factor to finally do something that they've been thinking about doing for a long time, just never been able to justify the reason for themselves until now, is a really fun aspect to let that excitement that they have for that upcoming event kind of spill over into some self care and improvement for themselves as well. And seeing that confidence level change along the way, combined with the excitement of the overall reasoning why they're getting it done, is a lot of fun. So when a patient comes in looking for veneers, oftentimes they have an idea of what their goals are and what they're really looking for. So kind of getting a sense of honing into what I would say professionally that we can offer them based off of what their desires are coming in the door is aligned. And once kind of those stars are again aligned, if you will, and everybody's gotten the unknowns out of the way of making sure we're not going to start offering something that they have no interest in to begin with, basically the actual preparation of the tooth is so minimal. You don't have to shave down a whole lot, definitely a little, but not a lot to where you don't even feel it most of the time outside of just some vibrations. Usually we don't even have to get a patient numb for the actual smoothing down or kind of recontouring of the natural tooth itself. And then, so we would have them essentially laid back, shape and preparation made on the tooth that kind of create some space where we would need it to be for the veneer to fit on naturally, and then take some digital scans that we would send to the lab and have them fabricate it for us and then cement it back on for them. And the next thing you know is it's cemented on, looks like they grew it themselves.